I'm sitting here with Dr. Nikko, and we are going to talk more about breast lifts. So, Dr. N, tell me, what is one of the biggest questions you get with whether a patient needs a lift or not?
Probably when they come in, if they know they need a breast lift, they're going to ask, do I need an implant or I don't?
Interesting. So why would somebody need or want an implant if they're already getting a lift? Like they're removing breast tissue. So why would they need a lift?
Great question. So when we do a breast lift or a mastopexy, there's different techniques. The technique that I use, I tend to remove the tissue in the bottom that's making patients sag. So in essence, we're doing a breast lift and a breast reduction at the same time. So patients, they will be smaller. So one of the first questions we ask patient is, okay, ultimately, compared to the size you are now, do you want to be a little smaller, same size, a little bigger, a lot bigger? Most of our patients would say, if I can just lift them up, I don't mind being either the same size or I don't mind being half a cup bigger, or the most we would get is, you know what, a cup bigger. Because most patients with saggy breasts, they feel like their breasts are big enough. They don't really want to go more than 1 cup bigger. Okay. So in order to achieve that, now if the majority of patients want to be relatively the same size or a little bit bigger, you can't just lift the breast up and then if you add the implant, now we'll talk about do you need an implant or not by answering this question. Do you want any fullness in the middle if you're not wearing a bra? Now, if you're wearing a bra, you will have fullness naturally because you're pushing your breasts together. But most patients would say, 9 out of 10 patients would say, well, I want some fullness when I'm not wearing a bra. That's cleavage. Cleavage, that's implant because 75% of cleavage is from the implant.
Correct.
So if you're doing a breast lift and you're not removing tissue, you're really like lifting it up and you're adding an implant, and then patients will end up being 2 cups bigger, and that's not what they want. So how do we do that? We have to remove the tissue that's making them sag. So we're subtracting some, and then we figure out how big they want to be, and then we figure out what size implant. So it's a little bit subtraction, a little bit addition, adding a little bit of fullness.
So we're doing math in the OR.
Yeah, a lot of math, a lot of geometry. And so a patient would wonder, okay, so if I need a breast lift and I want cleavage, how big of an implant I need? Well, it just, again, that's through the measurement. We talked about size in another video, and that's through measurements. And it really depends, Stephanie, on how much breast tissue I'm removing.
Okay.
If the patients start out and they're really, let's say they want to be smaller, then obviously if they want to be smaller, then we can't really put an implant in. We have to remove all the breast tissue and give them a breast reduction.
Gotcha.
If they don't mind being on the same size or a little bit bigger, that's when the implant comes in. And I would say 90% of the time, we use an implant.
Gotcha. Okay, that makes perfect sense. So I would say too, after talking with patients and maybe we've worked with the vector machine and we've already shown patients what they could look like simulation in our office, they'll notice that they have like a slope. Like would you say just like a kind of a ski slope when they don't have an implant? So it's very, very natural, just a very natural breast that's lifted. So if they do want that bump or that full cleavage, that's where you need the implant.
Without a bra.
Without a bra.
If they want a bump without a bra, that's when that little implant comes in. Now that little implant is going to go underneath the muscle. And normally we would, again, we talked about different implant shape, but that implant is going to go up and in. And that's going to give them the fullness here, not like up here, but just right. And then the rest of the skin excision, the rest of the tissue excision is going to wrap around the implant.
Okay.
Now, if we have someone with a lot of sagging, then we would typically do the breast lift reduction first, and then we let them settle for 3 months and then figure out an implant. But a lot of times they want to do it together, and I do that too. But I tell patients, keep in mind when you do it together, statistically, they're going to have a 25% chance of having some minor revision because it's very hard to put an implant. You're adding something, you're removing skin, and a lot of times you don't know their skin elasticity.
Exactly. It's skin elasticity. If you have already poor skin elasticity, you may have to come back for a revision. It is you're much more prone to it.
Yeah, I think that's really the main X factor when it comes to revision. We really don't know how good the skin elasticity is. You can certainly guess. I mean, we do see a lot of derm patients, we see cosmetic surgery patients. So I'm very good at guessing how elastic the skin, but at the end of the day, we really don't know Because a lot of patients, they want it just perfectly right, and sometimes they have little skin here and there that needs to be revised, and that's very easy.
Right. There's a lot. Again, we're adding, we're subtracting, we're playing with skin, we're playing with muscles, so there's a lot that goes into a breast lift. So again, that's why you have to come in for a personalized consultation with Dr. Nikko and I, and we can help address all of those issues and figure out if you're going to just do a lift or if you're going to need a lift and an implant. So,
yeah.
Perfect.
Thank you.
Well, thanks, Dr. N. Very informative. So call our office, 713-960-1311. We'd love to talk with you and get you scheduled as soon as possible.
Thank you.